Okay, just for a little bit of entertainment and fun, and to really simplify things, I'm going to talk a little bit about rotational equilibrium, moments, and maybe how foot orthoses work. So this is really about a mechanical effect, and we're going to talk about kinetics and kinematics. And I've got some willing volunteers. Okay, well done. First slide, Connor, please. So you're going to see it. I think in terms of biomechanics, we need to keep it as simple as possible. I think that's a lovely little quote. And I agree with Justin, how we communicate with our patients is very, very important. Next slide. So everybody in the room should know that when we talk about kinetics, we're referring to forces. When we talk about kinematics, we're referring to alignment. And certainly when I was first educated, it was really all about alignment, which is kinematics. So we were looking fundamentally at frontal plane biomechanics or frontal plane movement. As the years have evolved, more and more research is bringing us towards kinetics. So how do foot orthoses work? Do they alter the kinetics? Do they alter the kinematics? Probably fundamentally it's a little bit of both, but it is moving more and more to the unloading modifiers. Okay, next slide. So keeping it really, really simple, this is a seesaw, and this seesaw, like the one on the stage, is in rotational equilibrium. And it is a state of uniform rest, and it will stay in that position until we apply force. More accurately, it must be an unbalanced force. Next slide, two people up here, please. So if we put a weight on either side, and it's equal-ish. You've got to balance it, guys. So fundamentally, we've now applied a weight to either end, but it's still in rotational equilibrium. So the kinematics have not changed. It is still in the same position as the previous slide. If we were able to measure the forces in the seesaw, it has changed. So the kinematics remain the same, but the forces have changed. Okay, next slide. So, 3 people on it. This is why we had to lengthen this seesaw. It was actually a kid's seesaw that was quite small. Luckily, one of our staff happens to be a carpenter, because we need 3 people on one end. So, in this case, down you go, guys. 3 fireflies sit on one end, and very obviously, you see a change in alignment. The seesaw has rotated about its joint axis. Now, the magnitude of what happens here is that where do you apply this weight? Where do you apply the force? So the further we go back along the lever arm, the more the seesaw tilts. Okay? Now, if we could now measure the force underneath the very bottom of that seesaw and the ground, just think about that for the moment. Now, next slide. 2 people go. So 2 people hop off and go for dinner. The angle, sit down, Ellie. The angle doesn't change. We still have the kinematic position, but if we could measure the forces have changed. So in terms of our orthotic prescriptions and Ritchie braces, sometimes we do not see changes in kinematics, but we do in the kinetics. Does that kind of make sense? Essentially, we're moving people around the jigsaw. Very, very simple concept. So I think that that's kind of a really intriguing one. Thanks, Ellie. We're done with that now. Yes, thank you. Next slide, Connor. So how do they exert their mechanical effect? There are other effects as well, which we could talk about: neuromuscular, neural, proprioception. But at this moment in time, we're just simply talking about the mechanical effects. We've got to think about internal and external moments of force. And I think the longer that I'm in this and the older that I get, the less I know. And that's being honest. So sometimes we don't know how it's working. Okay, next slide. have a little look at this video. This final year podiatry student has a fused subtalar joint. I first saw a video like this, Trevor, at your course. And how are we creating this movement when you've got a fused subtalar joint? Because the movement's actually happening at the ankle. Okay. So I'm quite interested in then how we treat something like this. So what happened here was a group of students came to our lab, and usually we only see 1 or 2 people at a time because we're in Sligo, but 30 arrived, first time ever from NUIG. And we decided to just ask, did anybody in the group have a problem with their lower limb? Because we're all podiatrists, and how do we treat these types of conditions? So this is Sarah. She's actually in the audience here. Where are you, Sarah? Do you want to come on down for a moment? Yeah, not really. So Sarah's history was that she had a tarsal coalition. She did have a lot of pain. She had injection therapy. She was in boots. She was in orthotic therapy. She was still in a lot of pain. And in theory, they were talking about doing a triple arthrodesis. Isn't that correct? And when she came along, all the pain was on the lateral side of the foot and leg. So you're thinking perineals, that type of thing. All I thought was joint coupling. What can I do? How do I offload those structures? And what we then decided to do was on the spot, we casted her for a Ritchie brace. I said, look, this is the best I can do. And you were getting ready to go for the triple arthrodesis, isn't that correct? So actually, you tell us what happened then.
What happened
when you put the brace on?
Oh, so before I would have had a serious limp, and I've heard all the jokes, my left foot, everything. My favourite band is Limp Bizkit. But when I was walking down the stairs there, I wouldn't have been able to do that before without being very hesitant and having to watch exactly where my foot was positioned. Whereas now I can just go up and down. I can even run, which I don't like, but there is no pain in it at all. Like, I'm working now in a non-podiatry job in steel-toe cap boots for standing for 8.5 hours a day, and there is no pain whatsoever. Not even a twinge.
So I think that's kind of an example of we're just moving people on the jigs or on the seesaw. So I kind of think, thank you very much for coming along. And it was really intriguing that the orthopedic surgeon was really quite annoyed that I had taken a cast for a Ritchie brace. Isn't that correct?
Oh, yes.
Absolutely raging. And I said, why would he be so annoyed? We're just trying to help a colleague who is a podiatrist. So, and the result was really quite quick, so that's unusual as well, but it was fantastic, so thank you very much. Just a little case history at the end of that. So I'm done and dusted.